Good afternoon, White Plains. Good afternoon, everybody. 2:30 on January 12th, 2022. Hope everyone's having a good day so far. Okay, this is going to be a very quick update. We're going to be sharing this information in various modalities. So Facebook Live update, which will then be available on the timeline for anybody who's on Facebook. We're also going to send out this update via K-12 alerts. So folks will get that email. It'll be on the district's website. Of course, we're available to answer any questions that you might have. The total composition of today's update is to kind of talk you through the guidelines, the guidance updates that we received from the New York State Department of Health and the Westchester County Department of Health late yesterday evening, and what we're thinking and what we're seeing in terms of how guidance, statewide guidance and guidelines for public schools may or may be adjusted and maybe changed with regard to COVID-19 mitigation. So I'm going to start with the one that is sort of we haven't gotten the full update with yet, but I'll share with you what I know based on, and some of you know this already too because you watched, you read, or you listened, based on the governor's update yesterday on contact tracing. So contact tracing in the state of New York will likely be moving to what the governor called a more self-management care situation, where people are sort of managing their own situation with regard to COVID-19 positivity and subsequent isolation or quarantine. So what does that mean? It means that it's very likely in the coming days that the State Department of Health will forego contact tracing, focus its efforts on other areas that they have determined to be able to make the biggest difference, which for them right now is testing and vaccinations. How that plays out in the individual counties will remain to be seen. However, I can tell you right now, based on our continued partnership with the Westchester County Department of Health, folks are doing everything they can to contact trace, but they're also at their limit. As you all know, there have been a high number of COVID-19 positivity cases all over the last 2 weeks, and contact tracing for every one of those people has been a real challenge, not just here at school, but also for the departments of health at the state and at the county level. So it is very likely that if you test positive for COVID-19, you're not going to get a call from a state or county contact tracer. You will still hear from us, and we are still connecting with parents and guardians at this time. That, of course, may change in the future depending upon the shifts and requirements at the county level and at the state level. It's also connected to the guidance update that I'm going to share with you. Now, you don't need to take notes. You're going to get all this information to be able to peruse yourself. But even better, if you find yourself in a situation where you need to apply this guidance, our team members are going to be there to help you through it as well. But I do want to share it with you. And then, as always, if I'm able to, I'll answer any questions that are in the comments. I know this was a sort of an impromptu update, so we didn't have any questions coming through via email. So let's move on to the guidelines, the adjustments in accordance with CDC, state, and Westchester County. We're going to first start with isolation. This is all predicated off of the guidance that we received last night from Dr. Amler in the Westchester County Department of Health. So with regard to isolation requirements, this is now students who test positive. Students who test positive for COVID-19 are required to isolate for at least 5 days, regardless of vaccination status. So if you test positive, you have to isolate for 5 days. That is different than what it had been in the past. Day 0 is the first day of symptoms. For asymptomatic students, the day COVID-19 test was performed. So if you're asymptomatic, it's whenever you got your positive result. Now, students may attend school after the 5-day isolation period, provided that symptoms have improved and that they're fever-free without medication for 24 hours. So in all, if symptoms resolve and students are feeling better and moving in the right direction and come back after 5 days, certain symptoms such as loss of taste, loss of smell may linger, so that's not being considered as symptoms that haven't abated yet. If asymptomatic students develop symptoms after testing positive, the 5-day isolation period starts over. So then whenever you develop symptoms, that's when your day 0 begins. Again, you don't have to write it down. You don't have to commit it to memory. We'll work with you on there if need be. So students who test positive should continue wearing a well-fitting mask. As you know, they should be wearing a mask around others at home and in public for 5 additional days. And at the end of their 5-day isolation period, if they're unable to wear a mask, they need to remain isolated for 10 days. That's isolation. So quarantine. Now, what's different here? This is quarantine is for students who are not vaccinated or have not completed the primary vaccination series, right? So that's the 2 shots, 14 days following the second shot. Boosters are not part of this equation. Who came in close contact with somebody who was COVID-19 positive must quarantine for at least 5 days after their last close contact, where day 0 is the most recent day of contact. Unvaccinated asymptomatic students are eligible to participate in the White Plains City School District Test to Stay program, which will begin next Tuesday, January 19th. Again, parents and guardians need to opt into that Test to Stay program. That program will then allow asymptomatic unvaccinated students to continue to attend school, but testing during that time. Now, students are not permitted to participate in sports or extracurricular activities during that 5-day quarantine period and are required to quarantine when not in school. So essentially, these changes are really going to assist in students being able to attend school. A lot of factors in there. Have to be asymptomatic if you tested positive. If you're a close contact and you're unvaccinated, you have those steps you need to follow. The good news is that we will work with parents and guardians and, of course, our children through these processes as they play out. The other piece of good news is that we are going to be beginning Test to Stay on Tuesday. And we have additional tests coming in tomorrow, so we have a good supply of tests to run that program. It is important to understand that if your child is presently isolating or quarantined, please don't just send your child to school tomorrow. You're going to be contacted by your school nurse to let you know what the situation is pertaining to your particular case. But there is of course, this is going to begin immediately tomorrow. So students who are part of a contact will immediately benefit from this change in guidelines. Health and safety is going to remain, as it always has throughout the pandemic, our highest priority for our children and our entire educational community. I also recognize that for some folks who are hearing this message right now and who are reading the guidance changes, it doesn't necessarily bring a feeling of comfort. It may elicit feelings of anxiety. We are going to work with everybody and try and support everybody as best as we can moving into this next phase. I'm thinking about this as sort of as phases in the pandemic. So moving into this next phase into the pandemic as we're shifting these guidelines, we are absolutely available to assist and support any community members who may be concerned. As always, I need to offer my really unwavering thanks to every member of our community for all of your support and continuing to help our children remain in school. Moms and dads, caregivers who are keeping kids home when they're not feeling well, thank you. You're helping. You're helping us to keep us from not getting sick here at school and also not closing down classrooms or worst case scenario, even schools. So thank you for all of your continued assistance. Again, you don't need to remember any of that. What did he just say? Do I need to rewind? No, don't worry about that. We're going to send everything out to you. It will all be available on the district's website. It'll be available on Facebook. And any questions that you have, we'll be happy to answer them to the best of our ability. As new information comes out, if we receive any additional information, as always, we will share it with you as soon as we believe that we have a good understanding of the guidance. Some folks were asking me, Joe, this came out around 6 o'clock last night. Why didn't you share it with us last night? It's because I wanted to make sure that the additional information that the governor had indicated yesterday was going to be coming out today didn't have any contradictions. The last thing in the world that we want to do is cause additional confusion out there in our community, because we know that this is already confusing. And, quite frankly, the members of the New York State Department of Health and the Westchester County Department of Health and CDC, they're using the best data set in front of them, and they're trying to work through all of these challenges. So kudos to them. Thank you for everybody in the White Plains City School District who's working so hard to support our kiddos. And I will look right now in the comments See if there are any questions here that I can answer. Good afternoon, everybody. Good afternoon, Dina. Hi, David. With so many people testing positive at home and the rise in cases, there is no way to do. Okay, thanks, David. Hi, Sarah. What email address does the saliva test come from? Sorry, Sarah, I don't know what email address you're going to be receiving the PCR saliva test from. Do check your junk mail regularly just to make sure that in case it comes through and it ends up in your junk mail. If you have any questions, you can always feel free to reach out to us here. CDC, okay. Hi. If my child tests positive for COVID-19 and has to stay home for 5 days or more for quarantine reasons, there an online... So yes, remember, we have the quarantine instructional continuity program in place. If your child has to stay home for a period of time with COVID-19, please reach out to your child's teacher. Again, we'll connect with you as well. Thanks so much for your question. Hi, David. Require vaccination to participate in all extracurricular. School districts can't require vaccination. Oh, there we go. Thanks, Jamie. Verbosity via Material Health. Thanks, Jamie. That's great. Thanks, everybody, for helping out. Fantastic. Please require bi-weekly testing for all those. So again, we have testing program available for everybody. Folks should please sign up for testing, but it is something you need to sign up. We cannot require it. But we do have a good number of folks now participating in the testing program, which is great. Thank you. Thank you very much, Mary. Julia, given these new guidelines, is it necessary for fully vaccinated students to opt into the Test to Stay program? It's not, but you can still be in the in your testing program, but you wouldn't opt into Test to Stay because you won't end up in Test to Stay. Great question. Thank you. Thanks, Dina. If a child's in the classroom tests positive, does the whole class still quarantine? No, not at all. Great question. Thank you for asking it. Nope, that will not be the case. Hi, Danny. Any news on cancellation of midterms? Our Regents exams being canceled as well? Hi, Danny. Yeah, midterms are going to be canceled just like the January Regents. Their information is coming out from Highlands and high school. If you haven't already seen it, you should be getting it shortly. Thanks for that question. Everybody, I think I got everything. Thank you so much. If you have any questions, feel free to reach out to me. Happy to help in any way that I can. If I don't know the answer, I'll tell you I don't know the answer, and we will absolutely share any additional updates with you. Big thanks to Nurse Maggie and everybody in health services for your continued flexibility and being able to help us operationalize all of these changes. And again, as always, thanks to the Board of Education, the Reopening Committee, and everybody who's been working at this for darn near 2 years now. So hopefully we're starting to see a little bit of a brighter light at the end of the tunnel. Hey, stay safe, stay warm, and stay WP proud. Thanks, everybody. Have a great day.